All right, continuing now with the heart circulation. So now you should be an expert on the heart anatomy. So the different chambers, the septum, the sulci, the internal, external, different vessels coming in and out of the heart, right? So we're going to kind of put all of that together now as we continue. So we established that the heart itself was actually two parallel little hearts, little pumps. They fused, underwent torsion, and what we have now is two side-by-side pumps. And the anatomy retains that, the physiology retains that as well, right? Two side-by-side pumps. The right side of the pump, or the right side is the pump for the pulmonary circuit. And if you know pulmonary is the lungs. If you speak Spanish, pulmón is the lungs, right? So the right side of the heart, its primary task is to send blood from the heart to the lungs. So if you remember that, that's going to be a big help for you, right? So the right side of the heart is trying to get the blood oxygenated. It's trying to send blood from the heart to the lungs, the pulmonary circuit to the lungs and then back to the heart. Circuit implies we're going and we're coming back to the same location. So the right side of the pulmonary circuit are the vessels that carry blood to and from the lungs, and then back to the heart from the lungs. The left side is going to be the pump for the systemic circuit, for the whole body system, right? So vessels that carry blood to and from all body tissues. So we have basically two simultaneous pumps, but they're going to have a very, very different task, right? So very, very different workload. So the right side from the heart to the lungs and back, the left side from the heart to the whole body and then back. So again, the colors here are going to signify the amount of oxygen present in the blood. So if we have blue, that indicates oxygen poor blood, carbon dioxide rich blood. Red, oxygen rich blood, carbon dioxide poor blood. So where would we expect to find oxygen rich blood? We find that in the systemic circuit. The heart's not going to want to send low oxygenated blood to the rest of the body. The heart wants to send highly oxygenated blood to the body. Right? So this is going to go to all the parts, your arms, your legs, your head, the whole body. And then eventually it's going to work back to the heart. So here we have what we call the systemic circuit to the body and back. And then the pulmonary circuit, we start out blue with no oxygen. We go to the lungs, pick up oxygen, and then come back to the heart. So important circuits here, right? So this is what this is trying to tell us, right? Pulmonary and systemic circuits. Now, I will need for you to know some detail, right? In the path, at least the major vessels in which the blood will travel, right? So again, this is a very sequential type of process. It's a circuit. We can start anywhere in the heart, anywhere in the system, and it would kind of arrive back at that same spot. But it's pretty standard to start at the right atrium. So we're going to start right here at our right atrium. So the right atrium receives blood from three parts, if you remember. From the top, we receive blood from the superior vena cava. From the bottom, we receive blood from the inferior vena cava, and from the coronary circulation, from the coronary sinus. Right? So three inputs of blood into the heart. From the right atrium, we go through the tricuspid valve or the right AV valve into the right ventricle. Right? So right atrium past the right atrioventricular valve or the tricuspid valve into the right ventricle. So this is still within the heart. Now we're going to go out of the heart, right? We're going to pass another valve. I'll talk about the valves a little bit later. We're going to pass through what we call the pulmonary semilunar valve. The semilunar valves are going to separate the basically the arteries from the heart, right? So right ventricle through the pulmonary semilunar valve to the pulmonary trunk, which is a major artery. This is fused, right? It's one path. And then we're going to go into the right and left sides. So we go from the shared pulmonary trunk to the right pulmonary arteries, left pulmonary arteries, and eventually we go to the lungs to pick up oxygen. Once we've picked up oxygen, we're going to leave the lungs through the pulmonary veins. Our veins are bringing blood back to the heart. Right and left pulmonary veins bring blood back to the left atrium. And now we're ready to proceed through our systemic circuit, right? So left atrium through the bicuspid valve or left atrioventricular valve, left ventricle. And once we're in the left ventricle, we contract, we go out through the aortic semilunar valve to the aorta, and then finally to the whole body. And again, eventually we drain back through the inferior vena cava, superior vena cava, coronary sinus, back to that right atrium. So again, I hope that makes sense. Let me kind of come back here with more detail. So starting our circuit, right, we drain in from the superior vena cava, inferior vena cava, coronary sinus into the right atrium through the right AV valve or the tricuspid valve into the right ventricle through the through the pulmonary semilunar valve, that shared pulmonary trunk, then going to the left lung and then going to the right lung. Lungs pick up oxygen. Now we work our way back to the heart from the right pulmonary veins, left pulmonary veins. All four of those vessels dump into the left atrium through the left AV valve, or we call the bicuspid or mitral valve, into the left ventricle. We go out through the aortic semilunar valve into the aorta to the rest of the body, gas exchange, and then eventually work our way back through these vena cavas there, right? So it's a whole circuit of blood flow. You will have to know that. There's a lot of significance in all of that path. If something goes wrong, we have to know where the problem is, right? In order to alleviate the issue and get that person healthy again. So the anatomy that you can memorize, now let's kind of zoom out a little bit and see what's the significance of this. Right? So this is important. So equal volumes of blood are pumped to the pulmonary circuit and the systemic circuit. So the right and the left side of the heart are pushing the same amount of blood, equal volumes of blood. However, it's a big difference in the distance that they have to push that blood. Right? So if you're in the pulmonary circuit, that right ventricle doesn't have to contract too hard. It contracts very, not very strong contraction, and it moves the blood from the heart to the lungs. That's not very far, right? So it's a very short circuit, and it's considered to be a low pressure circulation, low pressure circuit. Systemic circuit, wow, it's gonna have to contract and push the same amount of blood to your fingers, to your toes, to your head, to the whole parts of the body, right? So it's gonna have to push the same amount of blood a lot greater distance at a lot greater pressure. So systemic circuit is gonna encounter a lot more resistance, and a much longer pathway. Now, form fits function. There's going to be a visible distinction because of this difference here. So the anatomy of the ventricles reflects these differences, the differences of the pressure, of the distance. So if we were to cut the heart in half, not front to back, but we cut it from top to bottom, we notice a big distinction in the walls and the myocardium of the heart. So the myocardium of the right ventricle is the hollow area, the chamber, right? The right ventricle is lined with a very thin layer of myocardium. The left ventricle is encircled with this very thick muscular layer of myocardium, right? Why? Again, they're pushing the same amount of blood. It's like two people at the gym basically have the same amount of weight, but this one is just having to move that weight to a very short distance. This other one has to push that same amount of weight and a lot greater distance and a lot more time, that kind of stuff. So again, much different workload. This is doing a lot more work compared to this side here. So that's what they imply by anatomical and ventricular sort of differences because of this path there. So I've addressed this a little bit. We have the pulmonary circuit, we have the systemic circuit, we also have then this coronary circuit. So this is the coronary circulation, the functional blood supply to the heart muscle itself. So this reminds me a lot of those of you that like to barbecue, right? I don't know if you like to cook, you know, barbecue, that kind of stuff, cook outside, grill. Normally, I don't know, maybe I'm different than everybody, I don't know, but normally whoever's grilling, they like to kind of sample the best pieces. Let me see if that's ready. This is good, right? You're kind of snacking and tasting as you're cooking, right? Well, the heart is going to have to distribute blood to the lungs, is going to have to distribute blood to the whole body, but the heart is going to get the first choice of the most highly rich, most highly oxygenated blood, and that's what we call coronary circulation, the functional blood supply to the heart muscle itself. Again, these anastomoses, and it's not always as picture perfect as the artists draw it, but again, we'll kind of explain it like that. So coronary circulation, right? Coronary circulation, we have these major arteries, right and left coronary arteries, the marginal artery, circumflex artery, anterior intraventricular arteries. We have these important veins, right? Small cardiac, anterior cardiac, and great cardiac veins. So just by trying to analyze the names, I hope you can kind of guess to where they're going to be found on the heart. So let's start right here. So we're looking at then the idea of coronary circulation. So we have this coronary sinus, which goes all the way around the heart, right? Coronary sinus, and we're going to find then our right coronary artery. So there's the right coronary artery going around, and then, you know, surprise, surprise, we have the left coronary artery. I want you to see kind of where they originate from. They originate right from that aorta. So we're leaving out of the aorta, and one of the first branches is right off of the aorta, right? So right and left coronary branches. On the left side, we're going to go down that intraventricular septum, or I should say intraventricular sulcus, intraventricular groove, all the way down and then back up the backside of the heart, right? So that's that anterior in the front intraventricular artery. The circumflex artery, when I think of circumflex, I think of kind of like, I don't know why, it just wrap around, right? The circumference of a circle, we're flexing around the circumference. So this is going to be a branch off the left coronary. So we start left coronary, continue down into the anterior intraventricular. And then as we branch this way, we start in our circumflex around to the back of the heart there, right? On the right, we have our right coronary. And then we have on the anterior side, the marginal. And again, in the back, we have the posterior intraventricular artery. So Again, this is a simplification. There's a lot more little detail to this circulation, but it gives us a pretty good insight. We have to oxygenate every part of that heart, right? It's working hard. It needs a lot of oxygen, a lot of energy, nutrients. So we have to have a good circulation here. Now, anywhere we send blood, we have to bring blood back, right? And this is then the blue. So deoxygenated blood is coming back. So it would start here and it works its way back to the great cardiac vein. And the anterior side wraps around to that coronary sinus. Anterior cardiac veins, small cardiac veins feeding into the anterior cardiac veins as we work back to that coronary sinus there. And then the coronary sinus that bleeds into then that right atrium. So the coronary circulation. Looking now at the back of the heart, and how do we know it's the back? Again, the apex pointing now to the other side. Right, so we're looking at the back. Major vessels have been cut, but let's see what we can identify. So here's our atrioventricular groove, coronary sulcus there. This big aggregation of vessels is our coronary sinus. We can see paired. They're shown in red. But they're carrying oxygenated blood, but they're actually veins, right? So we have our left and our right pulmonary veins. We have this trunk and then this, branch. This is our pulmonary artery, left pulmonary artery, right pulmonary artery. This big curvy vessel, this is the aorta. Here's our superior vena cava, inferior vena cava feeding into the right atrium. And then we have in the back, again, our middle cardiac, sending blood to the coronary sinus, our different sort of right coronary vein or artery, left coronary artery. So it's showing you a lot of detail there on the heart. Okay, so what can happen, right? We want things to function well. We want everything to be okay, but there can be some imbalances. There can be some things that go wrong. If there are issues of circulation, there's not enough circulation to the heart. We've established the heart cannot be anaerobic. The heart cannot sustain an oxygen debt. So if there is something sort of affecting circulation to the heart starts to signal this as a type of thoracic pain. And we call this angina pectoris, pain of the thoracic area. So pectoral area. So caused by fleeting deficiency in blood delivery to the myocardium. So the myocardium is not getting sufficient amount of oxygen. And that pain in the chest starts to radiate to the left side. So if you have a person that starts to complain of, my heart is hurting, or my arm is hurting, or even kind of radiates to the neck, to the jaw area sometimes, that's not a good sign. It's that you need to get that person to seek medical attention, as soon as possible. If things don't get addressed, angina pectoris can proceed to what we call a myocardial infarction, also known as a heart attack. So in a myocardial infarction, we have some sort of blockage. There's a blockage in the coronary circulation. If the blockage is severe enough for long enough, we start to have cell death. These cells asphyxiate. They don't have enough oxygen. Those cells die. So these dead cells, if the patient survives the infarction, these dead cells are then replaced and repaired with scar tissue. And scar tissue is not going to contract. So then it starts to have a negative impact on the future functionality of that heart. So backing up here, let's say that we have a blockage, let's say right here, right here. We have a blockage at that point on the right ventricle. Would you consider that to be as severe? Or would it be more severe if the blockage was right here? So if there's a blockage, anything sort of distal to that blockage could be affected. So we might have some cells that are damaged on this little part of the right ventricle. And we already said the right ventricle doesn't do that much work, so it may not be as tremendous of a deal as this, right? If the blockage is here, then we start to have cell death of all of these ventricular cells, then that whole ventricle is going to be non-functional, right? That cannot sustain life. So why do some people survive heart attacks and some people don't? Well, it depends on the location of the infarction, of that blockage there, right? You may have heard of a bypass surgery. If the blockage is there, they say right at that little arrow, there's a block. Well, they can make an artificial detour and kind of route artificial vessel or vessel from within the same body around that blockage to allow blood to flow to these other parts there. So something else, right? Let's say that the patient is suffering from an infarction. Would you recommend the defibrillation paddles, right? Ready, clear. Should we jolt a person that's in myocardial infarction? Would that make them better? Hope you answered no, right? This is not a electrical issue. This is a blockage, right? You can jolt them and shock them as much as you want. See how high you can make them jump off the table. It's not going to make a difference, right? Because here it's a circulation problem. So we're not getting enough blood to the basically to the heart itself, right? So not an electrical issue, a transportation issue, a vessel issue, a blockage there. So infarction. All right, so I'm gonna stop this one here. One more video now to address the valves, and then that should be enough for you to work with to really start to become comfortable with the heart, with circulation, pulmonary, systemic, coronary, and just to kind of have a picture of this very dynamic pump that's in our body. So let me come over here.